And CBS 6 is celebrating Women's History Month. Good evening, I'm Bill Fitzgerald.
And I'm Janine Samuels, anchoring our coverage tonight from Capitol Square in Richmond. I'm sure you can hear the bells are ringing. Now, I am surrounded by monuments to remarkable women who have left a huge impact on not just Virginia, but the country. As part of Women's History Month, we wanted to share a life-saving study out of VCU Massey Cancer Center that is also making an impact on those recently diagnosed with breast cancer, specifically Black women who are disproportionately burdened by this disease. Now, according to the American Cancer Society, breast cancer is the second leading cause of cancer deaths after lung cancer in women in the United States. However, it's the leading cause of cancer deaths in Black and Hispanic women. Now, from 2016 to 2020, the breast cancer incidence rate was higher in Black women compared to white women in 4 states: Alabama, Louisiana, Mississippi, and here in Virginia. In contrast, the breast cancer death rate was higher for Black women than white women in every single state except Washington. Plus, Black women are more likely than white women to die of breast cancer at any age. Now, because of these alarming statistics, a doctor in partnership with community members, patients, survivors, and physicians is trying to level out the playing field by addressing these significant health disparities for Black women with breast cancer.
My husband is Kevin. Tajma is my oldest daughter. Jordan is my youngest, and I'm Janice.
Janice Graham will always be thankful for her husband, 2 girls, and protector, River.
But he has been my road dog, like my comfort.
But the stark reality of why River entered her life in the first place felt like a curse, not a blessing.
In 2019, in December, I went for my regular mammogram.
Christmas came and went. Then Jolly St. Nick delivered an unexpected blow.
I had a letter in the mail saying, hey, come to the doctor, call us to get another exam.
After a series of additional tests, then 2 days later.
I hate to tell you this, that your results came back and it was breast cancer. And I was like, I already knew it. Like, I knew already. My sister had been diagnosed with breast cancer a year before, like exactly the January before.
Her mother diagnosed a few years prior. Janice's world came crashing down.
It was a lot.
In the months to follow, Janice underwent immunotherapy, resulting in a rash wrapping 90% of her body. Then chemotherapy, a single mastectomy, radiation, and a hysterectomy after genetic testing came back positive for cervical cancer, plus complete hair loss.
It was rough. It was rough, but I just say, by the grace of God, I'm here.
Yay!
God's grace lifting the dark cloud of cancer. Doctors declared Janice cancer-free.
I rung the bell in October 2020.
When asked how she got through it all.
And my husband is amazing. That's how I got through. He was my coach.
Her husband stepping in as her coach inspired her.
This is actually the Sisters Informing Sisters Facilitator Guide.
Janice is now empowering women to be an advocate in their own care.
It's a blessing to have this program. Like, Dr. Sheppard is amazing to just even think about African-American women. We think of all of the things that women go through just in life in general, and then to add breast cancer on top of it is just a whole nother set of responsibilities. And this is just a blessing, like, just to be able to support women that are going through this and to say, you're not in this by yourself.
Dr. Sheppard of VCU Massey Cancer Center is tackling the harmful effects of the differing levels of cancer care on historically marginalized groups.
Black women have a 40% higher mortality rate from breast cancer.
The mission of this research program, in this case, is to connect breast cancer survivors with women who have been newly diagnosed, guiding them toward the light during a dark time.
So I do think that it is encouraging to see a person who has completed their treatment, completed their recommended treatment, and is standing, or sitting across from you, that they've survived. Once you hear the words of a cancer diagnosis, it really is life-changing. So the coach goes through what we call our Talkback model, and that's what we feel like is the crux of the intervention in terms of that woman being active and engaged in her treatment and decision-making.
This particular research project, an effort almost 2 decades in the making, leads the American Cancer Society in naming Dr. Sheppard Researcher of the Year.
Wow, so it means a lot. It is affirming just in terms of the work that we've been doing for a long time.
Time well spent.
Like, this is something that I can do for me to help other people. And I often say that my battle with breast cancer was for me too, was something that I had to get through, but also something that I had to get through to help somebody.
Such an amazing story that's already impacting so many women. Congratulations to Dr. Sheppard on her research findings so far and on obviously being named the Researcher of the Year. Now I wanted to share some of the details of the Talkback method that she just mentioned. Dr. Sheppard shares that this acronym can help anyone navigate health concerns with their doctor. There are 4 basic but very important steps. The T is for tell. Tell your story to your doctor. What you've been going through, how you feel, your preferences as it relates to your treatment options, like frequency of visits that will be required, location, and travel. A is for ask questions. Write your questions down before your appointment. There are no dumb questions. Ask them all. The L stands for listening actively. Make sure you understand what your doctor is saying. Record the conversation maybe, or write down what they say and ask more questions if necessary. And then K is for knowing your options. Get clear on all of your treatment options based on what is recommended and, most importantly, what works best for your particular situation.